Okay, my name is Pat Snyder, and this is the presentation called How to Get Started After a Dementia Diagnosis. What are the overall things that you're going to need to consider right after that's happened to you, and you're going to be kind of thrown for a loop emotionally, and how do you sort of find your feet and get moving, and what bases do you want to cover as this part of the journey, this beginning of the journey starts? So let's just dive right into that and talk about, if I can get my computer to cooperate me, talk about your overall goals. Okay, what are the big things, overarching things you want to focus on? First of all, Dr. Daniel Coffer, who took care of my husband, said the main thing we want to do, our big goal, is to preserve the personhood, preserve John's personhood. That was my husband who had Lewy body dementia. And what that means is we want to be able to honor who they are. And that's going to be different according to the different people and different personalities and the different issues that are going to come up. But if you can just keep in mind, as much as you can, you want them to have as much of who they are, uh, in the best sense of the word, be able to shine through the whole journey for as long as possible, all the way to the end if it's all possible. Secondly, though, and equally important, you've got to protect your own health, and you're going to have to be proactive about that, or things are going to start to really get off. So it's very important to remember that the person with dementia is a human made in the image of God, very, very precious individual, but so are you as the caregiver. And so you need to take care of yourself while you're taking care of them and trying to preserve personhood. The other big overarching goal that I think that kept coming up over and over again for me, and that I've been teaching ever since and came up with this phrase, is to choose the lesser stressor. When you have two or more choices of how you can handle something, how you can manage something, choose the one that's going to give you the least amount of stress. And I go through, there are all kinds of presentations through the years of me giving lessons, and Lynette, as part of this class, giving lessons. And we hit on some things and go into a lot more detail of a lot that's going to be in this particular lesson right here. But the example I give in Choose the Lesser Stressor is clearly like you're having everybody over for Thanksgiving because it's easier for them to come to you this year than for you to try to go through everything that would take to take your loved one to go have Thanksgiving somewhere else. So what are you going to do? Are you going to do what you've always done when you had the family over? Or are you going to just let's tell everybody they're in charge of the food, and you'll set the table, and that's about all you're going to do, and let other people do all those other jobs? That's choosing the lesser stressor instead of doing what you're kind of used to doing. So that's just a simple little example, but you're going to have all kinds of decisions to make, and there's almost always going to be a less stressful way to do something. So I hope you'll keep that as one of your overall goals, to choose the lesser stressor whenever you do have choices. Okay, what about the strategies to carry out these choices? I definitely have a presentation, more than one presentation, where I'm talking about all or part of these. They call them the 5 Ps for you to use as strategies. They all start with the letter P: personify the disease, be positive, be proactive, be perceptive, and be persistent. So personify the disease, you may or may not be familiar with that term at all. But all it is understanding that basically that disease is kind of like having a monster in the room with you. And if you can separate the actions, the words of the monster from your loved one whose personhood you're trying to preserve, if you can love and nurture and support your loved one, but you can outsmart the monster, you're going to have a much better outcome. If you can adapt and adopt this strategy to whatever is going on. For example, if you walk in the room and they've got that suspicious look on their face that might come up every now and then, you recognize, that's not John. That's Louis. Now, why do I say Louis? Because part of personifying the disease is giving it a name, seeing it as a person. And it's an enemy, it's a monster, it's somebody you've got to outsmart. So you walk in the room, there's this suspicious look on John's face. Is that John or is that Louis? Always assume if it's negative, always assume it's Louis. And you can name yours whatever you want to name it. I named Louis because Lewy body dementia. And what I would do is I would say, I forgot something. I'll be right back. And I'd leave the room. I chose not to feed the monster because if you feed the monster, everything's just going to get bigger and worse. So you want to starve the monster. And you can do that very easily when you separate that expression on the face, those words that might be said, the actions that are going on, if you separate them from the personhood of your loved one. You want to love and nurture them. You want to outsmart the disease. So that's what personify the disease is. The second thing in your strategy list is to be as positive as you can possibly be in all the situations you're going to have to deal with. There's been a lot of research done on positivity for many, many years. And that research shows that when you can take a positive approach to something, the outcome is almost always going to be better. That does not mean that you turn into this little, milquetoast person that you're going to let everybody walk over you. That is not what I'm talking about. I'm talking about a strong positivity where you are making a choice and it gives you actually more control over your own emotions and the situation oftentimes if you can stay more positive. A part of this also is number 3, being proactive, being willing to step up and say things when they need to be said, to ask a key question when it needs to be asked, to not get white coat syndrome where you're afraid of the doctor, intimidated by a doctor. You have to remember that you are the key person in the overall management of this disease. You're the person who's always there. You're either right up front or in the background. You know more detail about symptoms than anybody else does, and you can articulate it clearly to the medical person who needs it. You may need to be more proactive in terms of building a team, in terms of working with family, working with pharmacists, all kinds of people who are going to be members of the team. You're just going to have to be willing to step out front and do things that are going to make the right things happen. That's what I mean by being proactive. Number 4 is be perceptive. And being perceptive is being certainly very sensitive to what is really going on in this disease right now. How can I have to be very observant about it. You have to link things together, start connecting some dots, be willing to think a little bit about what might be causing things. So you're trying to be perceptive as things happen in a room. If you're getting a certain behavior, for instance, might it have something to do with the light in the room? Could there possibly be maybe a UTI or some kind of infection that's causing this behavior? Maybe I need to think about that and check that out. So you're blending this proactive, perceptive thing together. You're going to blend all these 5 P's together all the time. But being perceptive can also have to do with the relationships that are closest to your heart. Being perceptive about people in your family, friends, all kinds of other people who are in the story. Why are they doing what they're doing? Why isn't my loved one that I thought would really be here to help me? Why aren't they showing up? Maybe are they grieving in a different way about this? That being perceptive about things and being willing to be open and proactive and discuss them or deal with that person in the most sensitive way, that is also going to help you. And of course, like I'm going to underline again, be very perceptive about the symptoms that you're seeing. What could have triggered a certain behavior? Could it be a change in medication? Could it be because the room is too cold or too bright or too dark? Or could it be the tone in your own voice that's making certain things happen? Or the expression on your own face that you're not aware of? So being perceptive is very, very important to figuring out how to manage this disease effectively. And here again, I have an hour-long video on these 5 Ps in more than one place in all the YouTube videos, and I'll be sharing how you can get to those at the end, especially if you're new and don't know about those. The last one is be persistent. In all of these things, personifying the disease, being positive, proactive, and perceptive, you need to be persistent. It is a long slog, but you're going to get better at it, and it's just not going to feel like it takes quite as much effort over time. You're going to learn how to navigate. I guarantee that's going to happen if you're just starting out. You're going to get there. Just hang in there. But try to practice these 5 Ps if you can as your strategies. Okay, it's very important if you've just gotten the diagnosis to know what kind of dementia you're dealing with. Is it a specific type of dementia? That matters in terms of your treatment approach and the management of the disease. So knowing that type, there are more than 80 types of dementia, according to some people, and even more according to others. But how you manage a Lewy body dementia versus how you manage Alzheimer's, those are two different things. And how you manage frontotemporal, quite another thing. So you need to know these kinds of things, and it's important that you ask the doctor for a specific diagnosis. Not just, oh, it's just dementia, or it's likely Alzheimer's. The little cavalier attitude. You really want to go dig a little deeper. And if you have to, you may need to go and get a second choice, a second opinion on that. Once you do get a diagnosis of a specific type of dementia or the one you most strongly suspect, go online to learn more about that specific type and check out symptoms of the other kinds of dementia. And the reason I say that is that certain recent research has indicated that people who have dementia, especially as we age more, as we're older, 76% of those folks are likely to have more than one kind. So mixed dementias are very, very common. And so for sure, if Lewy body's in any of them, you need to know about that because of the medication sensitivity. And you need to know that likely you want to get the good medicine that's most helpful as soon as possible, because for most LBD patients, that medication is more effective than it is for the Alzheimer's patient. So these are important. They're important reasons to know what kind of dementia that you're dealing with. Okay, let's see if I can get the mouse. Okay, you may need to seek that second opinion if the doctor says there's not much we can do, so just get your affairs in order. If that's what we got from doctor number 11, and that told me I needed to go find somebody else because it just, my gut said, wait a minute. I've even seen commercials on TV for Aricept. I know that there are some options out there. I got to find out to get some more help. And that's how I found Dan Coffer at UNC Chapel Hill, who said the opposite. The first doctor, the first doctor, number 11, said, oh, well, I'm not inclined to give you any medication. It just might not work well. And Dr. Coffer said, oh, there are lots of things we can do. That's the approach that you want. If the appointments are 15 minutes long and there's not enough time for you to have your questions answered, if the doctor is not listening to you as the caregiver, not respecting you as the caregiver, that's a clear sign because you need to get another opinion and get away from that physician, because there might be quite a bit that can be done for better symptom management. And that's going to give everybody in your family, everybody in your circle of people, a more gentle journey, a more gentle experience of the disease. And that's what you're going for when you're trying to manage dementia, is the most gentle experience possible. Now, where can you find support? And I'm going to move myself down here and hope that, there we go, so it's not going to get in the way. Go online, look for local and online support groups. Look for organizations like here in the Raleigh, Durham area. Dementia Alliance of North Carolina is certainly a very, very good group. There are Alzheimer's groups everywhere if that's the kind of dementia you're dealing with. And the events that are going to educate you, such as we talked about earlier in at our gathering today about a local event that's going to be happening. Educational events can be very helpful.
Is anybody else having trouble with the audio?
We have no speakers, so I'm going to keep on with this. I'm going to keep on. Lynette, you can let me know. Okay, please turn your microphone back off. Um, okay, you want to be able to have the educational event available to you because a lot of people are going to gather and they're going to be kind of on the same journey you are. It's a way to meet people, it's a way to get new information. You may want to Google the type of dementia to get specific resources that are involved with that dementia and tips for disease management. Uh, that's going to help you with that kind of thing. Uh, One of the things you need to be aware of online with groups online is negativity, because that can really throw you for a loop. Um, you don't want to be in a group where somebody is always taking over in a very negative kind of way, bringing you down. If you feel worse after you get off that group than when you were before you got on it, that's a sign you need to leave that group and find another group. Okay. Now, if you are taking care of a loved one in your home, which is almost always going to be happening, or they're going to be in a house by themselves, um, when you first get the diagnosis, you do want to make sure you have as friendly a living space as possible for what is already there in that story or is coming up. So walk through your living space to see how user friendly it is for caregiving. But you also might want to ask someone who has caregiver experience to do that with you to give you more ideas, or even an occupational therapist if you can get access to that type of person, to make that space more user friendly for you. And you'll be looking for things like ways they could easily fall, or spaces that getting through doorways, or do you need grab bars in certain places? And having somebody do that with you might give you some really good ideas. Okay, now this slide is packed full of things. So what this is all about is getting your financial matters, your legal matters in place as soon as you possibly can. You may need to see an elder attorney to get some of this done. If you haven't had it covered, you may want to be talking about all these things with that person. There may be a financial person also who might specialize in senior issues who might be able to help you. But things like wills, durable power of attorney, which is what manages your finances and gives you the right to be that agent representing your loved one in terms of paying the bills and making sure things are managed right. Healthcare power of attorney, extremely important because you are basically the voice of that person, and you are able to make sure that the wrong medicine, you can get it stopped. You have the right to say no to things and refuse care. It just puts you in a much stronger position legally and practically if your loved one is in a facility of some sort. Deeds to property are something you probably need to talk about with that elder attorney, because there's going to be all kinds of different scenarios and situations where deeds to property, bank accounts, modifications to investment trust, all those things are going to be different for different situations that you might have in your family. So you do want to have somebody who knows how to handle that best, as a confidant and as someone who can kind of guide you through that. Um, I did run into this and hadn't realized how much time it was going to take me, but you have to contact all insurance companies and become the contact person on record for them. Because my husband had gotten life insurance and things like that when he got out of the Navy, long before he met me. And so I had to go in and make sure that I was the person that they would be dealing with in case there was anything that we needed to do. And when John passed away, I was already that contact person. And they're going to want you to have the power of attorney, maybe the healthcare power of attorney. They're going to need a copy of that kind of thing. So just need to make you alert to those types of things that are going to come up. And here again, one of our mantras is sooner rather than later. So all of the things that you see on this slide are going to be better handled sooner rather than later. Okay, now they're going to be key medical documents also, and we have entire lessons about this. Lynette has done a great job on this, and you can, once again, there's going to be a slide about where you can find these, and we're always giving fresh, new, updated versions too as we teach the class each year. But the most form is a medical order for sustaining treatment. And in some states, it's called a POLST, physician's order for life sustaining treatment. That is a very important form to have if your loved one, especially if your loved one is in a facility, because you can be very specific about the kinds of things you want to be sure happen or don't happen. And so that's something worth investigating. And I do recommend that you go to the YouTube channel and click on playlist, as I'll explain in a little bit, and find that particular lesson that Lynette did about some of these forms and how important that they are and why they're important and how to manage them. The DNR form is the do not resuscitate form, and that is only good in its original form. You cannot use a copy of it. Same is true for the most form. You have to have that original copy there and with wherever you are using it. So you need to be aware that that's something you may want to keep uh, a copy of an original copy with you so that it is something if you're, say, in your car and you have it with you if you get to the hospital or the ER or some other place like that. For those of you who are dealing with LBD, Lewy body dementia, the medical alert card by LBDA is excellent, and it will take care of a lot of those medication issues for you. And you can order those from this lbda.org/go/ER. I do recommend that you get one of those. And if you don't remember this whole address, just go to lbda.org. And when you get to the homepage, go to resources and you'll find it there. Okay, building a support team. A lot of people on the support team. The right doctor. And there's a whole lesson on the right doctor. What makes the doctor right or not right? And doctors, you want them all to be of a certain sort. They're good listeners. They honor and respect you. They either know what they're doing already in managing the disease or they're willing to learn. The right pharmacist. Now, this person really has a depth of expertise in terms of the medications, in terms of medication interactions. They also know who the good doctors are in the community and how those doctors are managing things. And so they can give you a good question to ask the current doctor who may not have the same level of expertise as another one somewhere in your community. So that pharmacist is someone to develop a good relationship with. A counselor who's very effective with communication issues. I can't say enough about what a counselor did for us. For those of you who have read my book, Treasures in the Darkness, half the book is about what our counselor taught John early on, and then when he couldn't go anymore, continued to teach me. That made all the difference in the gentleness of our journey. A handyman. For those of you, especially ladies who are living alone, this person is so essential and will take a lot of stress off of you because they can take care of those things when you need to have some help around the house. And then there are three things that friends can do for you. You want to have a friend who can make you laugh, one who helps you vent and is willing to listen to you when you need to vent, one who will invite you out for respite time, getaway time, go get an ice cream cone together, go get a cup of coffee, go watch a movie, go take a little mini vacation or a longer vacation. It may be the same person. It may be three different people. It may be a combination. It may be a lot of people. I hope you have a lot. But really, if you have one, it'll make all the difference. So, friends who will do that for you are important to have on your support team. Another thing is knowledgeable and experienced caregivers, which if you are a part of the class right now where I'm teaching this, you have some access to each other, and I hope you will try to contact each other on the chat if you're in the class. And if somebody in particular is saying some things that are really resonating with you, try to shoot a message to them on the chat, even if you're on Zoom, if you can't do an in-person group, and see if you can connect with each other. People in your community who've gone through something similar, they're just very valuable to you because you don't have to explain. They just know what you're going through. A cleaning person coming about just maybe once a month even will help you keep your house in more order. It's easy for a house to become a chaotic place when this is going on because your brain is you just don't feel like you can cover every base, and things can kind of get out of hand. And then when you're in a cluttered place, it makes your stress be higher. So having a cleaning person at least once a month may be really helpful to you as part of your support team. And this doesn't have to be a paid person. You can get a friend or a family member who's willing to come and do that once a month. Remember, try to be resourceful in this. Paid caregivers for help if and when you may need them. They can make all the difference. If you can afford that, to have somebody so that they can continue to be in your home, you may not need 24/7 care. You may need to spend some time being perceptive about when do I most need to have somebody here. For me, that was getting sleep. And I had to have somebody there through the night to make sure I was able to rest. I could just go upstairs, go in my own little nest, away from all the fray, and just get rested because somebody was with John and they could take care of him, even if he got up 5 or 6 times a night. That was the first thing I knew I needed to do for paid caregivers. You might also need to know a list of good facilities near you, and go early, sooner rather than later. Go and have somebody with you so you're not having to do it all by yourself. Take one of those friends with you and just check things out. See, just get a feel for things. And what are the places that impress you as someone, if you ever need it, doesn't mean you ever will, but if you ever do, you've got a feel for what's already there. Do that much sooner than when you need it, and then the stress is not going to be on you so much. The pressure won't be. And then a massage therapist is someone I recommend, especially in John's latter part of his life, the last year when he was bedridden. The massage therapist who I used to take him to was able to come to our home, and she just made his life so much better. And he would light up when she'd come in the room. The muscle spasms, the stiffness of being in bed, that kind of thing. It just added a level of peace to his life that helped him so much. So you might want to consider that. You might not have thought of that before. But building a support team is a big, big thing. You need to ask for help because it is a team sport. This thing called caregiving is not solo sport. It's a team sport. You need to remember that. Create a list of the things that you need, and when somebody comes up to you after church or at the grocery store and says, "Oh, I'm so sorry, is there anything I can do to help?" You whip that list out, get it out of your pocket or your purse or wherever it is, carry it with you all the time, and then let them choose what works for them and works for you. Now, made everybody laugh this morning in class when I said that may be the last time that they ever approach you like that. But a lot of times people just want to know something they can do, and you get help, They feel connected. You'll feel more connected to the community. So go ahead and create that list and then take advantage of it when somebody comes up and says, is there anything I can do to help? Also, one of the things I didn't realize I should have done sooner rather than later was create an emergency kit. So, in case John had a fall or something happened and he had to go to the ER, he needed to go to the hospital, I didn't have to pack that at the last minute. I could do it when things were calm. And these are among the things that I think you should put in there. I'm sure there are other things we could add. You want to have copy of any legal or medical forms. You want to have those healthcare power of attorney. Maybe I think earlier today, I think Lynette suggested diagnosis and medication list. So what are his other, all the things he's been diagnosed with that need to be managed, and what are the medicines he's taking? That's something you may need to keep updated for this kit. A change of clothes for both of you. And I had to smile when I remembered I was taking John in the cold weather in the winter time, and in the kit I had my shorts and a light top, and I needed to change those things out. So if there's room in your kit, if it's a bag or a little suitcase, you may even want to have cool weather and warm weather clothing in there. Contact information for any key doctors in the story might be helpful. If you're dealing with Lewy body dementia, the LBDA emergency medical card that I talked about before, a list of any medicines that they're allergic to. And for those who have Lewy body dementia, this is really, you may want to add certain things to that allergic list, but you do want to be sure that you're not dealing with some key medicines like Haldol or Versed, that kind of thing. That's just not good for any dementia patient, and especially for a Lewy body patient. A book to read, something to have with you. But if you can avoid the ER and the hospital, if you can avoid them, please do avoid them if you can. Now remember to take care of yourself, because if you fall, they may well crash. And remember that it's kindness. It is an act of kindness to take care of yourself. It is not selfish. It may feel selfish, but that doesn't mean it is selfish. It's kind to take care of you, because everything's going to be better when you're in good shape and you're rested. Incorporate exercise and good diet into your routine, and please try to get respite getaways for yourself. They can be as short as a little walk outside or as extended as a 2-week vacation with a loved one or another loved one or a friend. Just getting away to completely recharge your batteries. As long as you've got covered the base and someone's with your loved one that you trust who's going to take care of them, get away and recharge for yourself. And most importantly, please protect your sleep, because this is the sleep deprivation is the one that gets to many, many caregivers. It got to me and almost did me in. And my kids said they were more worried about me than they were their dad, because they couldn't stop what was happening to their dad, but they were really concerned they were going to lose me too. And so you want to protect your sleep, even if it means bringing in somebody else into your home so that you can sleep at night. Another thing I did was when John was sleeping off and on during the day, which happens a lot with LBD patients, I would just a lot of times take a nap when he did, especially if it had been trouble. I had trouble sleeping the night before. So protect that sleep. Very, very important. And here's the last slide. There are what I've hit on are these broad things at the beginning that we have lessons on almost all of the things you've seen in this lesson, that we go into a lot more depth, give a lot more background, a lot more examples, and ways that you can manage these different kinds of things in a lot more detail. And you can find these on my YouTube channel. So here's how you find it. You just Google YouTube Pat Snyder Dementia, because there are lots of Pat Snyders on YouTube, but the only Pat Snyder who's doing dementia evidently is me. And so if you'll put that in as a quote when you go to Google, you should be able to find me. Uh, it's very important to find all of the 80 plus, and I think this one's going to be number 84 going up. So there are lots and lots of videos there. Click on playlist. Once you get to that channel, my channel, which YouTube Pat Snyder Dementia will get you to the channel, look for the word playlist. It's going to be somewhere around the top of the page probably, and click on that. That opens up all of the videos, not just a few, but all of them. And most importantly, it opens up the ones that are from conferences, the ones that are done by Dr. Bradley Bove from Mayo Clinic, which is brilliant if you're dealing with Lewy body dementia. It's a 20-minute medication management. It's the most brilliant thing I've seen anybody do in how to manage LBD. And it has a chart at the end of it that's to die for, that's a multicolored chart that tells you which ones are safer and which ones aren't. Like I said, it's brilliant. You're not going to find that if you just go to the YouTube Pat Snyder Dementia. It's not there because he's on my playlist, and that's a separate thing. But there are other physicians who are very, very well versed in how to manage dementia, well vetted. You can trust the stuff they're teaching. They've done deep dives into this and they know what they're doing, and they're on the playlist. And so you'll be able to see those as well. Um, Scroll down to find the topic you need once you get there, because there are 80 plus of them. So there are lots of videos there. So you just scroll down, and when there's a topic you think that's going to help you, click on that one. Some of those videos are a couple of minutes long, and some of them are an hour long. So it's going to depend on how much there's a deep dive into some things. So I hope you will take advantage of that. And that is pretty much what we're going to be doing. I'm going to open it up for questions. So let me stop the share.